following is a public service announcement regarding the use of aspirin, brought to you by the aspiring dental hygienist of Ivy Tech.
Come on in. And how are you today?
Fine. I really haven't been feeling good. My head is hurting. I kind of have a toothache, but I think that's from my head hurting so bad, and I just feel like I'm on fire right now.
Any throbbing pains lately?
All the time.
Well, if you have throbbing pains, you should definitely choose acetylsalicylic acid.
And what's that going to do for me? I don't even know what that is.
Oh, that's just aspirin.
You could have just said that.
So aspirin is actually really great for reducing any fever, any sort of inflammation. It's also really good for any sort of pain that's mild or moderate.
So if I had a slight fever, it would fix it? Or it could help it at least?
It could help it.
I don't know. I'm just kind of a weirdo about medicines, and I think I'm just going to need more information before I can just take something that I don't even know anything about.
Okay.
Don't you think it's a little ridiculous?
Maybe so, but you're in luck because I actually have some pamphlets with me today. So this pamphlet right over here kind of talks about the anti-inflammatory properties of aspirin. This one over here talks about how it reduces your fevers. And this one over here just provides some additional information. So you can feel free to take those home, browse through it, and that should help to give you more information about aspirin and what it can treat.
Okay, I think I'm just gonna need you to tell me more, I guess.
So aspirin is an NSAID, and that stands for non-steroidal anti-inflammatory drug. Its mechanism of action is to inhibit prostaglandin synthesis, which results in analgesia, platelet aggregation inhibition, antipyretic activity, so that's going to be your fever reduction, and anti-inflammatory activity. It is more effective if you utilize it before painful stimuli is experienced. So if you have a feeling that you're going to have an onset of one of these symptoms, go on ahead and take an aspirin so that it is more effective. Just be aware of some adverse effects. It can cause some irritation to your GI tract, so that can result in nausea, heartburn, vomiting, gastric bleeding, and you can also experience reduced platelet adhesiveness, prolonged bleeding, hepatotoxicity. If you have any kids,
Not that I'm aware of right now.
okay, so you do not currently have any kids, but if you were to ever babysit or have any children around you, just be aware that they are contraindicated for aspirin because it can cause Ray's syndrome in children and adolescents with either chickenpox or influenza. It can also cause Stevens-Johnson syndrome in children. Another thing to kind of keep aware of is that aspirin can sometimes cause hypersensitivity, but a true allergy reaction is uncommon.
So when it says contraindications, what does that mean, and what are the contraindications for aspirin?
So a contraindication basically means that not everyone can take this medication. So there are certain conditions that prohibits you from taking aspirin, so that includes allergies to NSAIDs. We were talking about children getting Ray's syndrome or Stevens-Johnson syndrome, so the contraindication will be for any children under 12 years of age. If you have any peptic ulcers or asthma, those are other contraindications to aspirin.
So I would actually really like to try some of this.
Sure, so I can go ahead and prescribe you aspirin. You are going to take 2 tablets every 4 to 6 hours as needed, and that should help with your pain.
Okay, I'm actually just gonna take some now because I'm really struggling.
4 hours later.
I hope you enjoyed our presentation. Just a few facts to remember regarding the use of aspirin. Check the expiration date and smell before consuming. Make sure you eat something and drink plenty of water whenever taking aspirin. Also, do not give to children. Do not take in your first trimester of pregnancy, and consult your doctor if you're on any blood thinners.
I'm aware of right now. I'm sorry.
Acetylsalic acid.
And what's that gonna do for me? I don't even know what that is.
Oh, that's just aspirin.
You could have just said that.
I actually have some pamphlets with me today. So this over here talks about